Hi, it's Dr. Sweeney here today to talk about ADHD, Attention Deficit Hyperactivity Disorder. This has been in the media a lot and over the last couple of years has grown in people's consciousness. Now, ADHD is a condition where, by its very name, people have lots of problems with paying attention, with focusing, and also have a constant urge or feel to be quite active, to be hyperactive. Now, in order, they think, to sort of qualify for a diagnosis of ADHD, it's usually something that people have had symptoms from childhood. And it can include a real inability to concentrate and focus. Often people describe spending a lifetime where just everything is unfinished and undone. They're very good at starting things, but very rarely do they manage to successfully finish something. They've often got a history of struggling at school with academic work, perhaps being seen to be a bit of a daydreamer, and also struggling in adult life to hold down a job. It can be very distressing and disruptive. The hyperactivity part of it can manifest itself as a constant uneasiness, a real feeling of needing to move, even just move a certain part of a limb, just as a kind of release. And that feeling of needing to move, again, can prove to be very distressing and very disruptive to people's quality of life. So these are common typical features. Getting an assessment for ADHD can at times be difficult, and often can involve completing a lot of questionnaires, going back to times when you were a child. Often you might need friends or relatives to help provide information, about how you were as a child coming through to adulthood. But having an assessment, and if you are diagnosed with ADHD, it can be life-changing. From a point of view that when people have spent a lifetime of struggling to focus, struggling to complete things, finding great difficulties, and it can be very distressing and can lead to anxiety and depression. So all of a sudden, if you're on the correct medication, can allow you to focus and become much more productive and successful in your endeavours in life, whether it be through education or work. So it's really important that if you do feel that you've had a lifelong, since childhood, problems with concentration, the constant need to fidget, and that you've struggled your way through life and it's really affected you, then it's definitely worth speaking to your healthcare provider about starting the process of being assessed for a possible diagnosis of ADHD. If you are found to have that, then there are medications that are available. We actually use stimulant medications, which are controlled drugs, which can be used, and they actually have the effect of people with ADHD. It makes them feel more focused, calmer, and more settled. And as I said, it can be completely life-changing. So these medicines are available. It is something that is treatable and manageable if and when the correct assessment and diagnosis are made. So if any of the things that I've said today ring true, it's worth speaking to your healthcare provider about the possibility of a diagnosis like this, and go ahead and try and seek help. Until next time, see you later.